Dietary supplement drug interactions.
A new class of health supplements, which are basically used for weight loss as well as bodybuilding, are now high in market, and approximately 50% of the US soldiers report using at least one dietary supplement per week, and 64% of college students participating in athletics also use these performance enhancing supplements. However, these supplements are not without risk. The proportion of drug-induced liver injury that are due to dietary supplements are currently around 20%. Furthermore, bodybuilding and weight loss supplements account for at least half of the injuries suffered. Health supplements might also be spiked with illegal or unlisted ingredients like anabolic steroids, and although they can be declared adulterated by the US FDA, but nonetheless they are very popular in the market. People do consume them. A case to point is the plant ephedra, which contains ephedrine, a sympathomimetic alkaloid, and these particular alkaloids are also incorporated in the official pharmaceutical medications. People taking supplements which have ephedra are known to have a higher instance of adverse effects in like psychiatric symptoms, autonomic hyperactivity, heart palpitation, and gastrointestinal symptoms. One 1,3-dimethyl-amylamine or DMMA was until recently widely incorporated in the health supplements, and in the year 2010 it was found in around 200 supplements and had an annual sale of around $100 million. The producers of these supplements listed it as a natural component of the geranium plant. However, the presence of DMAA in the plant could not be verified, and that led to the conclusion that it was incorporated in the extracts by chemical synthesis. One of the common extract supplement was Oxyelite Pro by the USP Labs LLC, and it was found to have other ingredients like caffeine, bohemia, bacopa, cercium, and rauloxin or yohimbine extract. A study on a small number of healthy volunteers with the supplement indicated that it increased lipolysis, metabolic rate, heart rate, and systolic blood pressure over a short term, as well as led to an increase in appetite, body weight, and BMI over a period of 8 weeks. However, it was found that accidental supplementation intake by children had a case of side effects like tachycardia, nausea, vomiting, as well as cerebral hemorrhage in New Zealand. A more insidious or dangerous kind of adulteration is addition of unlisted ingredients in the dietary supplements. Example would be anti-obesity drugs rimonabant, orlistat, sibutramine, or analogues thereof, which are found to in the weight loss supplements in Germany, Turkey, China, and Poland. Side effects of these drugs are panic attack, psychotic episodes, as well as increased blood pressure and heart rate in people using these adulterated supplements. Botanical supplements are considered to be safe because traditional herbal medicine is said to be the precursor of both drugs used for modern medicine, which were based on plants like aspirin or morphine, as well as the contemporary dietary supplements. And they have a sustained popularity all over the world due to the fact that they are natural, that is derived from plant root, leaves, or barks, and are among the oldest of therapeutics. A common motivation for taking these substances is improvement of the overall health. It has also been found that botanical use is correlated with non-smoking and a better self-health reporting. It has also been found that patients using the herbal supplements do not report the use of the same to the healthcare physicians, even though the botanical supplements could interact with the prescribed medication. A major problem associated with the concurrent exposure to other compounds like pharmaceutical smoking with the heterogeneous herbal supplements is that it often hides the cause of toxic mechanism in clinical cases even when the dose of supplements are reported, and as such the reports of adverse effect directly attributed to the botanicals are generally rare. In most cases, effects are mild, like nausea, fatigue, or headache. However, serious clinical cases have been reported, which include drug-induced liver injury, mitochondrial dysfunction, oxidative stress, and altered bile acid homeostasis. It has been reported that there may be interaction between the competent anticoagulants like warfarin with the dietary supplements, mostly cranberry juice, as well as ginkgo and ginseng. So, in, an, in a conclusion, can be stated that even though the market of dietary supplements and nutraceuticals is to improve the health or well-being of the customer, and it's quite enormous, but they are not necessarily safe for everybody. Like regular drugs, the supplements do have active ingredients that provide physiological or pharmacological effects, which may also have adverse effects on susceptible individuals. Therefore, more attention needs to be paid on the adverse effects and potential interaction between the drugs as well as the pharmaceuticals in order to avoid serious medical outcomes. Therefore, users and physicians should consult updated literature before beginning or advising a regimen including these substances.